message in, and I've just popped a message about downloading a quick polling app that we're just going to do once during the session just to see who's on the call with us today. But I think that most people are here. And as I said, we're delighted that you're joining us and you're giving up an hour or 3/4 of an hour of your time to join us for our third Employer Insight session. I hope that you've managed to join us for the other two, where we've looked at the new standards of proficiency, we've looked at registration issues, and today we're going to look at the focus really is going to be on fitness to practice and culture and supporting your staff. Now, you can't do lots and lots in 3/4 of an hour, but we're going to give a general overview of some things that we thought you might find really useful and things that you've actually requested in your evaluation forms, which has been super useful to hear what you thought about our sessions. So we will get on if that's all right. Fiona and I are going to be running the session. You met both of us in the last sessions, I know. So my name's Kim Tolley. I'm a professional liaison consultant here at the HCPC. And Fiona, I'll let you say hello as well.
Hi everyone, my name is Fiona Campbell. I'm professional liaison consultant for the HCPC, and my job is about delivering the professional liaison service in Scotland.
Thanks, Fiona. And we're joined by a couple of colleagues, my boss Kelly Green and Patrick Ormsby, and our media manager Becky, and also somebody called Gareth, who's going to talk a little bit later about some of our fitness to practice data. So I'll let perhaps them introduce themselves as they go, if that's all right. It might be a lot easier than getting people flicking on and off their videos at the moment, if that's okay. So a bit of housekeeping. I've talked about the polling app, if that's okay. The session is, as I said, finishes at 11:15 today. I will be looking up and down, I'm sorry, but I've got my screen up on the other screen, so you'll see me looking up and down. And we very much want you to use chat. So as you know from these sessions before, it's absolutely impossible. We wish that we could be in a room with you and have conversations with you. We are sort of planning to have some in-person events, and we are doing a few in-person events as with employers. But if you want to write in chat any questions, we've usually got buzzing chat going on. We're very happy. There's a few people answering your questions in chat. We're super happy to put some links and answer questions in chat. After the session, you'll be sent the slides and any links that we use. We've put them into a Word document that you'll find really useful. And after now these 3 sessions are over, we'll be putting them onto YouTube that you can access as well. So the recordings will be accessed as well. So hope that's actually okay with you. Brilliant. So I think we'll get on if that's okay. So this is what we're going to be covering today. Some really interesting material, and actually it's probably the first, well, probably it is the first time we've shared some of this really new data, because we published our Fitness to Practice annual report only last month. So it's the first time we've actually shared some of the data with an external audience. So we're really pleased to be sharing that with you today. Some of the learning that we can talk a little bit about some of the data and fitness to practice research that we've actually done. And we're going to look at briefly the impact of poor culture on where we all work and the support that's available for you as employers, as I've said already. So it's really nice. People are starting to say hello in chat. Do say hello if you'd like to, and say where you work if you want to. And if you want to put up any questions for both your colleagues and for us, then as I said, we're really happy that you put those, that you use chat. Our active social media team have asked that I could possibly, if anybody is on Twitter, if they could possibly use the Twitter handle #HCPC Employer Insights, that would be useful. And if you copy in @the_HCPC into your tweets, the HCPC will be very happy to retweet those and to say thank you very much. So it'd be really nice if you do. We do get a bit of a conversation, a bit of traction on this session. That would be really nice to hear from you and what you think about it. So firstly, wanted to promote, as we do in all of our sessions, our employer newsletter. So if you just literally want to put your phone up to the screen, you can actually log and you can actually register for the employer newsletter. It's only about 3 or 4 times a year, so you're not actually registering for anything absolutely horrific. And I see that Kelly's kindly put the link in chat as well. So you're not going to be deluged with us from emails, but there's some really, really good information. And in our last session, it was on managing concerns, and you can see there that we put information on Mersey Care concerns. We've also put some really good articles on supervision. So I hope that you'll find it really useful. And again, if anybody wants to write an article for our employer insights, do get in touch. Kelly will pop up our email and I'll give you our email later on for the session. And if you want us to come along to your place of work and deliver any sessions for you, such as the session we're doing today, then we'd be delighted to do that. That would be really nice. So I'm going to ask you my first little, if you don't mind, I'm going to ask you to go onto the polling app, and it's just really useful for us to see who we're accessing on these sessions. And as I say many times before, it gives us an idea of who's with us in the room and who we perhaps isn't with us in the room. And if you'd like to log on to slido.com and input the code employers3, and you can see there that it's changing. We can see who's with us on the call today. It just gives us a really big insight, and it only takes a couple of sessions into who's with us today. And I really like to get that instant feedback of who we've got on the call. I can see already we've got lots of occupational therapists and a couple of paramedics on the programme. We know it's difficult, 10 o'clock in the morning. We've tried different times for these sessions to try and get the maximum audience. We know it's difficult for you in practice to give up 3/4 of an hour in your time. So that's why we are really thankful that you're with us today. And we're hoping that the session will be super useful for you and for what we're going to discuss. Okay, so I'm going to leave it for a few more minutes. You can still, on your phones, you can still actually log on, but I'm not going to share it on the screen if that's all right. But you can still put your voting onto the screen. So we're going to start with a part of the session which is about fitness to practice. I'm going to hand over to Fiona if that's all right, and who's going to do the next few slides. So over to you, Fiona.
Thank you very much, Kim. Hello, everybody. And again, just to reiterate a message of thank you very much for joining us. We realise that you're all very, very busy people and perhaps the timing won't suit everyone, but many, many thanks for joining us today. I'm a registrant of the HCPC myself. I always forget to say that, but it feels quite important to say that, I guess, at this stage. I'm an SLT to trade with experience of working across the NHS and further education or higher education sectors. And I always think it's quite important to highlight that, I guess, because we all have the appreciation of, what it means to work in very busy and pressurised services, but also from a registrant's perspective about what it means really to not only work in those services, but work in them whilst adhering to, a set of standards around our professional behaviours, our competence, our ethical decision making and that kind of thing. So I thought it'd be useful today to, if we move on, Kim, if that's okay with you. Sorry, we're having to do this in Kim's moving the slides on for me. I thought it would be really useful today to start off with a bit of an overview and a definition really of what we mean by what fitness to practice actually is, because we know that registrants are fit to practice at the point of registration and at renewal of the registration, but our definition of fitness to practice is such that you're fit to practice when you have the skills, knowledge, character and health to practice your profession safely and effectively. And I guess it's important to highlight those main areas around skills, knowledge, character and health, because it becomes clear when we drill into the fitness to practice data that in fact we can see, concerns that can arise in any or a few of these different areas for registrants. Can we move on, please, Kim? So really by impaired fitness to practice, really we have our definition here on screen, and sometimes things do go wrong and we have to acknowledge that things go wrong, and we might be concerned that perhaps a registrant that we employ is no longer fit to practice, or, perhaps is no longer fit to practice without restrictions, or if indeed at all. So this is really our definition of fitness to practice here. And the key things to emphasise really is that the concern has to be serious enough to suggest that the person might be unfit or unsafe to practice without restriction, or, as I said, indeed at all. And that key emphasis has to be on, the word serious enough. So it's focused entirely on conduct, competence, health, or character for our registrants. If we move on quickly, Kim, if that's okay, I'm just going to talk you through a little bit about the terms that we use and the way that we discuss fitness to practice, because the term fitness to practice is also used to describe the process that we use here in the HCPC to investigate the concerns raised with us. So we talk about fitness to practice processes, which I'm sure you'll be familiar with. So I think importantly, for those that are not, it's useful to go over the kind of 4 stages, really, the main sort of essential 4 stages that make up a fitness to practice process. And that first step in the process is triage, moving into threshold, investigating committee and hearings that take place. And what's really important before I go through these stages individually is to highlight that cases can be closed at any particular point in the stage. So when we begin to present the fitness to practice data for you, it becomes clear, if you like, that quite a lot of cases are closed in some of those very early stages of investigation. So the triage stage is really just as it says on screen here, where HCPC receive a concern, we receive those concerns from a range of different people, and we'd be assessing that concern to determine really whether we've got the statutory powers really to investigate that concern. Many things we can investigate, and many things that we can't investigate too. If we move beyond that and it moves through triage, it will go to a threshold stage of fitness to practice. And really what we're looking at there is informing the registrant. So this is a stage at which the registrant and the employer, if they don't already know about it, would be notified of that particular concern, and where an initial investigation is taking place really to understand that concern in more detail. And whether there's a concern, if you like, that that there's enough information, if you like, that would amount to an allegation that the registrant's fitness to practice is impaired, it would progress further, and if not, we would of course close it at that particular stage. The investigating committee stage, many make it through to this, is where we really are setting out more details of the concern in the form of an allegation. There'd be more information gathered, and the registrant at this point in time would be invited to formally respond to the allegation in writing. And the job of the investigating committee is really to decide whether there's a case to answer, and whether the case in fact will then be referred for a hearing. So as we progress to hearings, that's where our Conduct and Competence Committee, or our Health Committee, if you like, would be looking at this information in more detail. The registrant would be able to attend and or be represented at that hearing. And really the job of those committees are in the hearing is to be deciding whether that allegation is well founded, whether there's evidence for it, and if so, what action could be taken. So important, that's a very quick overview of the 4 steps, and we're here to give you more information on that if you would like it. But importantly, as I've said, cases can be closed at any stage, and we do see that in the pattern that moves through fitness to practice processes. But really what I should outline is that in very serious cases where we think that there is an immediate public risk, public protection risk, or a risk in fact to the registrant themselves, or where it might be in the public interest, we would put in place an interim order. So that would put in place restrictions on that individual's practice, or suspension whilst that case might progress through these individual stages. And that's something I found quite interesting as a registrant coming to work with the HCPC, because I couldn't quite work out on the fitness to practice pages why there was some information for some, some registrants in the form of final hearings, and why in fact some information was not routinely available and made available on the website at that particular point in time. So really interim orders form a big part of what our fitness to practice team will be concerning themselves with. Kim, could I have the next slide, please? I thought it would be useful to take a little look at the percentage of registrants that are subject to concern, because we do see different patterns. And at this stage, this is our 2021 to 22 data, and we do note that some professions receive more concerns than others, and it's our job here really at the HCPC from here to really understand why this might happen. So we're looking here at the percentage of registrants that are subject to concern, and we're seeing some patterns where we see a little bit more in the way of referrals to fitness to practice for our per head really of practitioner psychologists, of our paramedics, and also at the moment our hearing aid dispensers. We see a little bit more in the way of referral of those particular groups of registrants. Now, that's not to say that there's anything necessarily that's happening that is going wrong there, but we might see different patterns and different practices that are taking place with these particular registrant groups. And as I said, it's our job here at the HCPC to really try to understand this and drill into this in a lot more detail. Next slide, please, Kim. I thought it would be helpful really at this stage to give you some context to some of the fitness to practice figures that have come in this is data from March 2022 here. So as of the 31st of March 2022, we had 279,388 registrants. And from 2021 to 2022, we received 1,583 new concerns. So in context, that equates to about 0.5% of the register. So quite a low number, but obviously, it's I think that's pretty much in line with other regulators too. We're around about 0.5% of the register. I think what's important as we move forward here, when we look at those that do not meet the threshold for investigation, or those that move forward to investigating committees and see that the case is closed at that point, is we're really seeing a bit of a pattern. Around about 50% of those concerns raised don't actually progress to that final stage of a hearing. So it's a relatively small number. So in 21 to 22, we had 407 cases that didn't meet the threshold, and then a further 316 that moved forward to investigating committee panels that were then closed, if you like, at that particular point. So we had 212 cases that went forward to final hearing. So a small proportion of the number of concerns raised do progress forward to final hearing. And of those that went to final hearing, we had 127 sanctions, if you like, that were placed on those. So if we move forward just a little bit, Kim, if that's okay, I thought it'd be useful to look at what those sanctions look like. So we had last year, we had 29 registrants were struck off the register as a result of a fitness to practice finding. So that's 0.01% of the total number of registrants. We had 37 suspensions, 13 conditions of practice placed on registrants and 25 cautions that were issued. Could we move on, Kim? Thank you. So I think it's really helpful, and I don't know why this shocked me when I come to work at the HCPC, but to look at the different sources, that the majority of our concerns routinely are raised by members of the public. Last year we did have a very high number of self-referrals from registrants themselves who are reporting either concerns about their own conduct, health, performance, that type of thing. So this time, or rather I should say last year, this was higher than the number of referrals that we in fact received from employers. So we had 278 referrals from employers ourselves. So we get a whole range, sometimes police, professional bodies, we get anonymous complaints of fitness to practice as well. But it is interesting, I think, to note that the public tend to make the most referrals into the fitness to practice process for people. At this point, I'm going to hand over to my colleague, Dr. Gareth Davis, who is Head of Insights and Analytics at the HCPC. I think we're in a position now where we're drilling into some of the data we've got in a little bit more detail. And whilst I think that some of what Gareth has investigated is so interesting, we could talk all day about it, we've picked out some core findings for Gareth to present to you now. So handing over to Gareth now. Thank you very much, everyone. And do pop any questions in chat. And one thing that I thought would be very helpful to say, of course, as well, is that we're so keen to work with you in the professional liaison service about, how we can better understand our fitness to practice data. If anyone wants to speak to this, because I think for me, what's really interesting when we go on to see certainly what Gareth is going to present is around the types of referral that come into fitness to practice and looking at prevention and how we could maybe perhaps support some of these from reaching those particular, those particular concerns.
Thanks, Fiona. I'm just going to shut the sun out because the sun's so bright here I can't see my screen properly. But yeah, so I'm head of insight and analytics here at HCPC. I joined a year ago. My background is actually in epidemiology, public health, healthcare services evaluation, and clinical research. And I've come here to try to apply some of that kind of thinking to the HCPC data. And I'm going to show you a couple of pieces of just descriptive analyses that we've done as part of a bigger piece of work that's still ongoing. So this first slide here is looking at cases that reached the investigating committee panel stage that Fiona described earlier. So they passed triage, they passed threshold, and they've actually been considered as a case and defended as described. So these are the rates. If I showed you the same chart of the numbers, what you'd see is that you get very few cases in the very elderly and in the very young groups, and they rise fairly steady in the kind of classic bell-shaped curve with the biggest numbers in the kind of middle ages. But what you really want to see is the risk. So this is the rate per 1,000 registrants in each age and sex group. So it's a comparative measure of risk. And what you can see here very clearly are a number of patterns. One, that the risk of getting into an ICP increases with age, and that's for both males and females. And it kind of rises pretty steadily from very, very low risk in the youngest age groups. And it kind of peaks around late 40s, early 50s, slightly different for males and females. Then it plateaus, and then it spikes again right at the end. The other important observation is that it's much higher in males than in females. So the relative risk, although the absolute numbers are very similar, but the relative risks between them are much greater in males. And I suppose the other observation from this chart is that the very highest rate is in the very oldest registrants. But I would emphasize that the actual numbers there are quite small. So although it's the highest risk, it is a small absolute problem. So that's looking at the rates for getting into ICP. So if we go to the next slide, Kim, please. It's the same thing, but looking at the concluded final hearings. And you see exactly the same pattern. It's at a slightly lower level because fewer cases get to a hearing. But again, a very clear relationship with age, increasing to late 40s, 50s, much higher in males than females. And again, very high in the very elder groups. But I must again emphasize that they are very small counts at that end. The big counts are all in the kind of high risk groups, which is the kind of 45 to 55 or to 60. So that the big counts and they're the big risk. So two very clear messages from that are that risks for getting in are age, increasing age is an increasing risk, and males run a much bigger risk than females. Okay, if you have the third and final slide, please, Kim. So this shows this is based on the final hearings again, and this is looking at the grounds for the case, the grounds one, so it's the primary grounds. Cases can have more than one grounds, but this is grounds one is what's regarded as the most important grounds. If you look at the column on the right, so this is for everyone, you can see here that 2/3 of cases that get to a final hearing are for misconduct, about 1 in 6 for caution or conviction, about 1 in 11 for lack of competence, about 1 in 14 for health, and then there's a very small number of other grounds. So that's the general breakdown. I've shown the same breakdown for some professions. These are the professions with the bigger number of cases at this stage of the process, because the small ones are a bit misleading. You can see there are some quite notable differences between the professions in terms of, when if you look at ODPs, who are the second column, the operating department practitioners, compared to the practitioner psychologists, the sixth column, they've got quite different patterns of misconduct and caution or conviction. But it was really important to just remember that for ODPs, the excess of caution or convictions may actually be a deficit of misconduct. So actually they have very low misconduct levels, which then makes their caution or convictions look higher. But it is interesting that they have slightly different patterns between the professions. So those are just three quick slides from a much bigger piece of work we're doing, and we hope to share more of this with you in the future.
Thanks ever so much, Gareth. I think it's a fascinating start to our data collection, isn't it, and our data interrogation, really. And I think what it does is it shows that we're at the start of that journey, aren't we, really? And there's so much more that we are finding as we go. And I think what we all feel at the HCPC is that it's really important to share this with the profession, so that you have some information about what we're finding. And it gives us clues. We can't actually extrapolate, can we, Gareth? We can't extrapolate the reasons why. You're looking at the hard data, really. And you've got this slide actually shows some of the reasons why, but underneath that are the reasons why these things occur, and we can't extrapolate that. We're just looking at the raw data. That's right, isn't it, Gareth, really?
Yeah, it is. I think there's a point, like you say, there's a point to which the analysis of the data takes us, and then from there we'll be conducting, or we'll be commissioning probably more qualitative work and maybe some audits to actually try to get behind what we can see in the hard data to understand the drivers of it and the causes and the effects and so on.
I would say, Gareth, it's very similar to the General Medical Council information, isn't it, really? And the GMC is quite clear that male doctors are more likely to get into difficulties than female doctors. So the trends and patterns are sort of similar in some ways, and I think that's really interesting to note as well, isn't it, really? Yeah. But we hope, we've shared with you what we've got at the moment, and Gareth's really spending a lot of time interrogating this. So thank you so much, Gareth. It's giving us as people coming out and doing sessions some really useful information to share with the profession, but also some really useful information for the professions to have that they can maybe look at and think about. So I think it's super useful. So thanks ever so much, Gareth. That's really useful. So what we thought we might do from there, I know there's some questions in chat, which is fantastic, and everybody's answering questions in chat, which is absolutely perfect. We thought we'd just have a quick look at a couple of reports that we actually wrote, which are really around fitness to practice complaints and culture and changing culture. And the first one was in 2017 called People Like Us, and it was a really good study that explored the reasons behind this disproportionate number of complaints that we even then were picking up with paramedics, and then we regulated social workers. So we actually looked at social workers as well and looked at the reasons why. We started to look at the reasons why, and this is what Gary says, we're hopefully going to commission some research to look more about the reasons that underpin these some of these trends. But at this time, what we looked at the reasons, and we found that there's a massive complex interplay of factors, as you'd expect, and quite a lot of it is to do with things like the way the profession's evolving. You know, I think this slide is an absolutely lovely one here about the differences between, I love that picture of the London Ambulance Service in years gone by, and how things have changed for paramedics and the different evolving roles that people have taken on and the amazing opportunities within the paramedic profession. But that has implications, you know, we think, for complaints, and this is what this report actually said. It's also, as we know, about public perceptions and expectations, which all the other regulators are picking up as issues for regulation. And Fiona noted earlier that the highest proportion of complaints that come in from the public are from the public. And the General Medical Council has done some research to show that although the highest complaints come in from the public, that translates into one of the lowest, or that translates into less referrals going on to hearings, because actually some of the complaints that come into the public don't meet our threshold, meet the General Medical Council threshold, and I'm sure that might be similar with the HCPC, although we can't extrapolate that at the moment. We've also noted, even in 2017, that there was the impact of complaints coming in to us was one of the things that factors was all about pressurised services and actually the culture of the organisation. So I think it's really important that we recognise that a shared positive culture and a shared positive workforce actually reduces the number of complaints, we think, and that's what this report actually said. So we looked at some of the things in the report about things that were positive about culture, and that actually we think, or the report extrapolated, reduced complaints, and I put some of those things up there. I think we're actually used to some of, this was a very early report, and the things that it said are very, very, I think they resonate with what's going on today. It's all about accepting professional responsibility, recognise the contribution of frontline staff. These things make people feel positive at work and make people feel like they're part of a positive workforce. So I think they're really important to even highlight them today, even though the report was in 2017. All these things are really important. And I thought in chat, if you can, if you want to share, if you've got time to share, any thoughts and ideas about how you create a positive culture at work. You know, it's always nice, we find in these sessions, for people to share information. So sharing those tips and hints would be useful. If anybody wants to put any of those things in chat, that would be really nice, I think. So as a manager, what can you do? Well, this is what our report actually said. And I think some of these things we've actually discussed in our previous webinars and in our Employer Insights magazines, but it's all about creating the right conditions, isn't it? It's all about making time, if you can, in your diary for having one-to-one chats or group chats with your team, and fostering that open, which we used to call the open door culture, and feeling that people can, if they Teams chat you, or they contact you, or they phone you, they have your mobile phone number, or they have your phone number at work, that you'll be available to speak to them. Giving people time, and also making up, which we know much more about now, but speaking up a real culture in your organisation, that it's okay if people come to you with difficulties and with concerns, making them feel like that's actually okay. And we know that there are more support structures in place called, you know, Freedom to Speak Up guardians in place to actually support staff. And thanks, Helen, you've mentioned a no blame culture and being available for support, which is really fantastic. And creating ownership in the team. So sometimes people speak up, sometimes that leads into continuous improvement and things that could be improved in the organisation. So creating that positive culture as employers is so super important. And we also did a report around the same time, which actually looked at, which was called Preventing Small Problems Becoming Big Problems. And I'm sure you as employers can recognise that. Sometimes if people come to you with a small problem, it can, if you deal with it, it can prevent bigger problems occurring. And again, this looked at sort of how we can actually looked at some of the reasons why, and the reasons why people engage with what's going on in an organisation and they disengage from things that are going on in an organisation. And again, I think some of the messages within this piece of research are really useful to you. And I thought it was really nice to share with you some of the reasons why staff disengage, the triggers for us to all, we all might feel like this at times in our organisation. We just want to disengage from what's going on, and particularly important in the current situation that we're all facing at the moment with acute workforce pressures and service demands. So, you know, workforce pressures do make us want to disengage, and if we're pressurised to operate outside our scope of practice, if we feel isolated as a profession, we feel our skills aren't utilised in practice, if we know, and we talked in our last webinar about continuing professional development, but we don't get support to do that. We don't get supervision when we need it. It says poor management generally, but I think we can all identify lots of things in that, but particularly dysfunctional work relationships make us want to disengage at work. A blame culture, which you've already mentioned in chat, and sometimes personal circumstances, things that we're struggling with at home, can make us disengage with work. And I think one of the best messages that I had when I was a manager was if I noticed that things were starting to go wrong with a colleague, I always made myself at the beginning of that conversation, when I was having a chat with them, saying, how are things for you? How are things? How are things at the moment for you? A general open question to see what's going on for them at the moment. Conversely, things that make us engage with work, because this is important, we all want to feel we engage with work and we enjoy work. Being part of a really good team, it goes without saying, doesn't it really? Feeling like the team and our manager makes us feel like development is really important to us. Where are we going in our career? Somebody's taking an interest in us, mentoring us, looking at the way our career is going to go in the future and taking an interest in us, really. Supervision, which we know, appraisal and personal development are really important. Support, I'm sure in your organisations you've got buddying systems, mentorship systems, preceptorship, really important. We've got a consultation that's just about to start on preceptorship, and we've got some, if you go onto our events pages, we've got some webinars on preceptorship, because we're reviewing the preceptorship's guidelines along with Health Education England, so they might be quite useful to you. Building professional networks. Now, some of those professional networks are at work, but some of them are from our professional bodies, and those give us a sense of real belonging and enable us as employees to get more from our work. And people have already talked about this no blame culture, but also being valued, you know, feeling that we are valued at work is so fundamentally important to the way we feel that our jobs are. And these things, I think for me, it was a reminder of how important these things are, because failures in care, failures and complaints that come into us as a regulator, but also you in your workplaces, are frequently the result of low levels of staff engagement and a feeling that we don't belong, a feeling that we want to disengage at work. There is a direct link between those things and complaints that come into the Healthcare Professionals Council, but also you as employers. So how can you support your professionals? Well, our report actually suggested some questions that you can ask yourself, and I think these are really important. I'm just going to pause while you just have a chance to read these, because I think they're really important. Thanks, Kelly, for putting the preceptorship webinars up into chat. So I think as an employer, these are some really crucial questions that you might like to ask yourself. Certainly, if I was an employer, I'd be taking a quick picture of those because as an employer, you also reflect on your ability of being a manager and an employer. And if you had to rate yourself from 1 to 10 on each of those 6 questions, where would you be and how could you improve as an employer, both as an employer and a manager? I think they give you a little idea into things that you maybe could improve or things you're doing really well. And maybe you can use them at your team meetings. Maybe you could ask your employees or your staff that you manage, you know, I'm just going to put these up. Tell me how you think, which one of these I'm doing best. Tell me which one of these things I could improve. It's a hard thing to do because asking for feedback is a sort of scary thing to do, but actually they talk about feedback being a massive gift, and it is a gift. If people give you feedback in these areas, it could be a massive gift, and it can drive change. So I think these questions are really super useful. There's the Just Culture information from NHS England, which I think is super useful as well. It's being really embedded within lots of employers across health and social care. So I'll just signpost that to you. And I know that Kelly will pop the link up in chat about the Just Culture information that's great. And I think these questions that are on the left-hand side of that piece of information are really useful to ask yourself as well when a complaint comes into you. So just a bit about what should be referred to the Health and Care Professional Council. There is a list on our website. We are really interested in serious or persistent issues that come up with staff, and that's a list of things that we should be referred to us at the Health and Care Professionals Council. I think it just gives you an idea of some of the serious, and it links clearly to some of the information that Gareth showed us in some of those cautions and convictions, misconduct. It shows those issues as well, they're coming up as well. But I think that information is all on our website. I also wanted to signpost you to our self-referral data, our self-referral information. Fiona clearly showed that we looked at the source of complaints that are coming into the HCPC. The public, remember, was the top source, but the second was self-referral. And some of those self-referrals, that means that your registrants are self-referring themselves to the HCPC. Some of them might not be necessary, and both to reduce the harm, because we know that having a fitness to practice complaint or self-referring yourself into the HCP is incredibly stressful. And as somebody pointed out in chat earlier on, the process of going through our fitness to practice proceedings can take some time, and that can be incredibly stressful. So we want to reduce referrals to the HCPC if we possibly can, unnecessary referrals, and some of those could be in the self-referral category. So we've got some fantastic information on our website about self-referral, and myself and Fiona can come to your workplaces if you want us to, and talk to your HR managers, to you as a group of managers, about much more about self-referral and what that actually means, and go through some case studies about self-referrals. That might be useful to you. There is an employer hub on our website that gives all this information in sort of one easy place, and certainly we all do this, don't we? We all save lots of links up to our on our desktop. Certainly, if I was an employer, that would be one link that I would have sort of on speed dial up onto my links and browsers, that I could have a look and see if there's any information that might be useful. All the information we're referring to is on our employer hub. Our professionalism in practice programme, Fiona and I have been talking a little bit about it, but we would be super happy to come to you if you want to email us at our website, our email, which is professional@hcpc-uk.org. We'd be very happy to work with you as employers to come and do sessions for your registrants, to talk to them about what we do and how we can support registrants and some of the important issues they might be concerned about, for example, CPD, audit, supervision, preceptorship. A reminder about the standards and guidance and what they actually mean. Their responsibilities to raise concerns, duty of candour, record keeping, some of the important issues are related to that. So we're very happy to tailor our events to you. They can be used for their CPD. Come and talk about, we can talk at, if you run events for your allied health professionals in your organisations, we're very happy to come and do sessions for them, or we're happy to do online sessions as well. It's totally up to you, but we'd be really, really pleased to come and speak to you. Fiona, have I missed anything out in relation to what things that we can provide for support for employers?
Well, I think that's really good, Kim. I just realised I'd switched my camera off, so I thought I should put it back on again to be a friendly and supportive face. One thing, no, I think that's a great description. I think the important thing is that this is a free offering. Well, it's part, of registrants' fees that have been paid to HCPC. So please do, have a think if you would like to approach us for anything, because we're up for, and particularly like the tailored bit. That this is not necessarily off the shelf, but if anything that you can think of that would be useful for your organisation. I was about to type in chat earlier, but then the conversation sort of took off. But I think it's also something to highlight is that for me, joining the HCPC, it was really useful for me to shadow some fitness to practice hearings that were taking place online. I found that really valuable in terms of my own learning about the fitness to practice process, but also just to understand the way in which panels conduct themselves, the ways in which registrants and witnesses' voices are heard. I don't know what I was expecting coming into work for the HCPC, but it was a really, really useful learning experience for me to see the depth of detail and the consideration that was, the individualised approach for every single registrant that comes into fitness to practice. So I would strongly encourage that. Yeah. What I have been doing is I have been in the background trying to find a link for the person that we go to if we want to attend a hearing, and I can't quite find it right now. So I'm hoping one of my colleagues might. Okay, I think they've rescued me now by putting in the link to the specific way to get in touch if you do want to shadow, because these are public, so anyone can attend.
Yeah, thanks ever so much, Fiona. We'd be delighted to come out and meet you. So just before you go, we will take if there's any other questions in chat, but I actually think they've all been answered. But while we're just taking any other questions, I'm just going to pop in chat. We really like to hear from you. This is the last of our sessions. So again, if you want us to come to your workplaces, but also if there's sessions that you feel that you would like us to provide for you as employers, we're happy to do some tailoring for you. And please complete our survey because it gives us some really important data about what works for you, what doesn't work for you here at the HCPC. We want to meet your needs really and support you in the really difficult jobs that you do. Kelly, I'm going to come to you because you've been monitoring the chat a lot, I know. Is there anything particularly that's coming up that you'd like to point out just before we finish off, if there's anything else?
I was just trying to type a little answer to Anna, who has asked about what support's in place for others that are involved in the process, so managers and staff. We have, I was just going to try and find the details. We've very recently signed up to a programme of support from an organisation called FOR. I think that's how you pronounce it, but I'll find the details and pop it in the link that then provides that kind of support that you're asking about, Anna. There's a question about length of time that I think is probably important for us to just talk about, because it does take a long time for cases to go through the process, and there's lots of things that contribute to that. One is the volume that comes into us, so the stuff that Kim, Fiona have been talking about this morning in terms of being able to make sure that we get the right things coming into the process, but that it isn't overloaded with things that maybe don't need to be there, will help with that time, because then it allows us and our colleagues in FTP to focus on those cases that should be there, rather than having to spread our resources too thinly across all the different cases that we have. So that stuff about employer referrals and self-referrals is really important, because we only really want stuff to go into fitness to practice that really should be there, and we can help with some of that decision making. Some of the stuff that we do webinar wise or workshop wise with managers will help with some of that decision making if you wanted us to do that. Other things that contribute to the length of time can actually be getting information from employers. So when we're investigating the concern, being able to obtain the information that we need. So we're trying to build our relationships with you really, so that we can also work better with you once we have a concern that we need to investigate, and sharing of that information and obtaining information in a much sort of quicker way really will help us progress cases. So there's quite a lot that we're doing. We do put reports up that go really into our council papers and report to council on all the improvements we're making around fitness to practice. Many of those are about improving the time that we take. Thanks, I think that's it. Thank you. I'll find the link for the support thing and I'll pop that in there.
Thanks, Kelly. That's lovely.
Thank you.
Okay, well, thank you very much for everybody. I just wanted to make a big thank you internally as well. Sorry to allow my time to say thank you, but Patrick has spent quite a lot of time turning the graphs from the information from our annual report into super graphs that we've been able to share with you. So thanks ever so much, Patrick. And he's been in the background doing all the links, all the IT tech during the 3 of our Employer Insight webinars. Thank you very much for Fiona and I for coming, but for Gareth particularly for coming also to share and be, proactive to share the information that we've got for you, even though it's in its early stages, even though you're the first audience that we've done that to. But we hope that you found that really useful. I think it really shows that the HCPC is really on a journey with its data and insight intelligence team. So we're really pleased to be working with Gareth and being able to share that information with you today. And thanks, Kelly, for being in the background and answering questions. Gareth, I'm going to ask you to perhaps to sum up, if you don't mind, perhaps if you finish by saying anything you wanted to about any data intelligence issues that we're doing for the last second of the session. So thanks very much for coming.
Thanks, Kim. That's right. I had trouble turning my camera back on then. Yeah, I just think it's a really interesting area, data-wise, and as I mentioned, we're putting a lot of work, a lot of effort into it, and I think we'll have some really interesting learning to come out of it, which will help inform the way we work, and it will be interesting to the registrants and the employers and so on as well. So I think it's kind of watch this space really in that regard.
Thanks ever so much, Gareth. I'm looking forward to watching this space. So thanks ever so much for giving up your time, everybody. Please do our survey. That would be super useful. I can see that Kelly's put the information about the support that's available for Fitness to Practice in chat. The chat's always available, you know, it stays, which is really nice. We will send you the slides and we'll also send you the links that we've used in the webinar. But lovely to see you all today. Take care and have a great rest of your day. Thanks very much. Bye-bye.